More contradictions, more confusion. Let's talk about it. So of course I've been trying to keep y'all updated and keep myself updated with these briefings that's going on with President Trump, America's president. I've been trying to keep y'all and me updated without actually having a hissy fit and going psychotic. It's really hard to keep up with the constant confusion, the constant contradictions that we see in here.
Thank you. Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
Oh, what are you asking?
And given the fact that taxpayers from
What's
every
that?
state
I
pays
got
for
you.
it.
You
No,
used
it's not
the
a
word
gotcha.
our.
What do
Our,
mean
you know
by
what
that?
our means? United States of America. That's what it means. It
Within
means
the states.
our. It means the United States of America. And then we take that our and we distribute it to the states.
So why did you
Not
say
that we
it's
have
not
to.
supposed to be state stockpiles that they then
Because we
use?
need it for the government and we need it for the federal government. But
To
when
give
the
to
states are in,
states.
no, to
Then
also
who are you
keep,
giving it to if it's not to the states?
to keep for our country, because the federal government needs it too, not just the states. But out of that, we oftentimes choose, as an example, we have almost 10,000 ventilators, and we are ready to rock with those ventilators. We're going to bring them to various areas of the country that need them. But when he says our, he's talking about our country.
He makes
He's
a
talking,
distinction.
excuse me,
And, sir-
he's talking about the federal government. I mean, it's such a basic, simple question, and you try and make it sound so bad.
So as you can hear, the reporters are on him. His son-in-law Kushner is not qualified for the position he has at the White House. There's many other people that he could have put up, but because in my opinion you want to put your daughter's husband up there and give him a good job, you would bypass all the qualified people that have a heart for American people, not just about economy and money and business, but they actually want these people to live. The protection equipment that Trump is referring to, he's referring it to as governmental property. After you saw all these governors cry out to him saying we are running out of equipment, we need masks, we need gowns, we need ventilators to keep the people alive and to keep the nurses and doctors alive and well so they can take care of the American people. Therefore, you will get your economy back. But if you don't have the people healthy and give them the proper equipment, we won't have anybody to run the economy, Trump. So yeah, he is basically now trying to deflect so that he doesn't look bad and say, well, when Kushner said us, he's referring to the American people, and that's not who he's referring to. He's referring to the federal government and agencies that needed possibly these protections so they themselves wouldn't get sick, not caring primarily for the American people. Pence spoke on, or rather he was asked by a reporter to continue to give some relevance to what he said pertaining to Medicaid and how this situation is going to affect people who don't have it. And because he didn't answer the question on yesterday's briefing, his answer today was.
And Secretary Azar, in a few moments, will explain just how the president's decision to make sure that no American will ever have to worry about paying for testing or for coronavirus treatment. I'm pleased to report that the president's direction, Medicaid and Medicare already expanded to coronavirus treatment and testing early on. And of course, the president just indicated how major insurance companies across the country are not just waiving copays on testing, but they're now waiving copays for at least 60 days on any coronavirus treatment.
Yeah, well, you just contradicted yourself because you said you didn't have to pay, then you said it'd be at least 60 days before you have to pay. Okay, continue. I do understand that they are taking care of the co-pays. However, there was also a question asked, well, why don't you just go ahead and reopen the Obamacare since we're in like a crisis situation? Because, Trump did everything in his power to stop the Obamacare, and it finally happened. Well, every time that question gets asked, he gets uneasy.
Thank you, Mr. President. This is for you and Secretary Azar. 10 million people say they've lost their jobs in the past 2 weeks. So how is this stimulus money for free treatment going to absorb the new numbers of uninsured? And would it not be easier to reopen the Obamacare markets or expand Medicaid?
So for an individual who had employer insurance, that's what I mentioned in my remarks, if you were employed and had insurance through your employer and you've now lost your job and lost that insurance, you now do have a special enrollment period where you may enroll in the individual exchanges of the Affordable Care Act. So that's existing law. Then what we're doing is taking from that $100 billion to providers, taking money and saying, if you're a provider and you care for anybody who's uninsured, we're going to compensate you for doing that. And we're going to compensate you at the Medicare reimbursement rates, and you are not allowed to bill that uninsured individual anything. So in many respects, it's better for those uninsured individuals. They're going to get first dollar coverage, they're going to get care in the United States, and the provider is going to be made whole from this program. So it's really an unprecedented, what President Trump is doing here with this money is an unprecedented disease-specific support of care for individuals to make sure that people get treatment.
Look, so long as it's free, 100% free due to the pandemic, that's a national federal government responsibility. As long as it's free for people who are insured and uninsured, then I like it. But I don't understand why Pence, who does not have expertise over it, is explaining, because when he said first that you're not going to pay a copay and then at least for the first 60 days, it's very much contradictive. They really want people to wear masks. And you know, me personally, I will wear a mask because I don't want to get sick. And I've been making that pretty clear ever since this situation happened. But what I found, what a lot of people found to be stunning and astounding, is that Trump got up there after the Surgeon General, National Security head, whatever he is, got up there and gave his sermon, basically preaching to people, telling them that we all should be wearing these masks, making sure that we protect, because apparently this 30-day stay at home, 30-day flatten the curve paper that Pence keeps putting out, that I'm like, please throw that damn paper down, please. Yeah, apparently that's not doing it, because there are still a mass majority of people, and you see them in your cities, your countries, wherever you at. You see that they don't wear it. You probably not wearing it either. You're probably not staying 6 feet away from people. You're at stores, and you probably don't want to look socially awkward. So you get in the line, and you don't want to be 6 feet away, and you don't want to have people hollering at you. So you take that risk, and you're up on somebody's back. Well, yeah, for y'all. Because those objectives are not working like they wanted them to work, so we can rush back making and building the economy back like Trump wants you to do, even though we ain't even at the curve yet. Yeah, that. Trump gets up there and he tells everybody it is recommended, and he makes sure that he emphasizes that it's recommended, not commanded, that you do put on those masks when you walk outside. He said that it's cool where the bandanas are CDC approved and that you're okay, but I won't be wearing them, is what he said. I'm not wearing it. And he emphasized, me? No. Come on, me in the Oval Office, imagine that. Picture that.
Okay, let's go, Steve.
If we could draw you out a little bit more on the advice on face mask, what would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass.
Are y'all hearing this? King, queen, dictate. So he's saying he's special. He's the president. He should be treated differently. Yes, but you are the leader, dude. And you still downplaying the severity. People are dying. That's what I don't get. How can he not? Then again, some people just don't have empathy. They don't have the capacity in their heart space to hold care about people. He's one of them. You thinking about the way you look, your appearance, as opposed to being healthy? So you're willing to risk getting sick and at your age possibly dying. And don't think you're exempt. Even if they set this out and put this out on their own, he can still get sick. The fact that he's concerned about how he looks is so vain and so self-centered that it is just ridiculous.
And hopefully it'll pass very quickly. Now, with that being said, if somebody wants to, I mean, most people can just make something out of a certain material. So it's very well designated. It's very simple to do. I won't be doing it personally. It's a recommendation. Okay?
It's a great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people.
The Surgeon General of the United States is the operational head of the U.S. Public Health Service Commission Corps and thus the leading spokesperson on matters of public health in the federal government of the United States. So understanding, Surgeon General, that this is confusing is definitely a correct statement. You should be the one from day one and on that's giving us the recommendations, giving us the demands, or I don't know how else to say it, putting out there what we should not be doing when it comes to masks. I don't want to hear from no one else but the head. He should have been the one from day one and only. I think everybody else should have backed him up. He should have been the one that set the statement and the standard for if he wants the public as a whole to wear a mask, if it's recommended. This shouldn't come from Trump. It shouldn't come from CDC. It should come from him. That's why we're so confused. Trump just made his statement. He doesn't respect the Surgeon General, so I wouldn't go as to give him all that much respect back. You get the respect you give me. So as you give me a good welcome and introduction, I will thank you, and I will just recommend or be strict or whatever. But Trump is telling you and everybody else, Surgeon General, that he's not going to be wearing it. He thinks it's ridiculous. He thinks he's above it. And he's basically sending the message to people that are like him that you should too not wear it. If you care about how you look, this is not a good idea for you. If you carry any position of power, then this is not something that you need to do. It's just the message he's sending. He's sending it to people like those Florida party goers that were on the beach after being told they could spread the disease to senior adults. They still was on that beach. Now we have Florida over 10,000 infected bodies, and part of that, half of that, could be due to those rebellious kids. But are they rebellious when you got the CDC telling them that they are not the ones that really are getting sick and dying from this disease, that it's seniors? That since they was carrying that message, I mean, why wouldn't them rebels and those party animals want to go out and have a good time? So yeah, Surgeon General is giving that message that now we are advising you to wear these masks. I don't like his explanation of as to why they did not put it out there to wear, made it mandatory. He's saying is because the people that were asymptomatic, no symptoms, they didn't want to send the wrong message. But that don't sound right. It sounds like you're taking this thing, getting taken up for Trump and trying to make him look good. The hell with that. I think they was just not trying to spend that money on those doctors. New York, Governor Cuomo, and Washington, California, all these states that were saying, look, we are running out of equipment. We don't have masks to give our doctors and nurses, and they cannot stay healthy enough to take care of people. We're losing people. I think they didn't want to spend that money, and he wanted to keep that stockpile. He was being stingy. That's what I think. And now that they are recommending everybody to wear a mask, because obviously they see something out here that they're not telling us. It may be that this is living in the air. You don't know. Hey, just protect yourselves. Okay, so yeah, that's what I wanted to say about that. And let me go ahead and conclude this video, and let me know what y'all think in the comments below. Since the beginning, he's been downplaying everything, and I just think you're not concerned. You're not concerned about the lives of people, and it almost makes you feel, as sad and horrible as this is about to sound, that you care more about depopulation, that you don't care that these people are dying because of the way you move and how slow you acting, and you have to get dragged, and CDC has to constantly pick up your slack. Like when he says something crazy, they have to come behind him and try to clean it up, and that's not what they do. They're scientists and doctors. They have to go by facts. So all that was all that, you know, there was a lot more, but that was just the basis of what I found to be crazy. Yeah, I'm sure it's going to be more, y'all. So stay tuned, because I will be keeping you updated. Be safe, wash your hands, and make sure that you wear a mask and don't be like your leader. Okay? Thank you.